Hi, I'm Kim, the lab director at Cypress Point Surgical. I'm going to talk to you guys about blood bank ordering. I know this scares some people, but we're going to go over it. Hopefully you'll have a good understanding. If you have questions, please call us. Extension in the laboratory is 6170. We are physically here from about 6A to 6P. After that, we always have somebody on call. If you have a question about something, you're not sure about something, we want to be really careful when it comes to blood banking, making sure we're getting the right people the right stuff. So give us a call. First thing I'm going to talk about is how to order a blood bank order in the laboratory system. So when you go onto your patient, you're going to go under laboratory orders. There's a quick pick list there, and there is one that says blood bank order. You're going to be prompted for 4 things. The first one is going to be, what has the physician asked for? In that box, you're going to either say type and screen, type and match, or whatever he's asking for. The second is going to be how many units and what the component is. So if you're asking for a type and match, you're going to say 2 RBC. If you're telling me that you need a type and screen, don't tell me you need 2 RBC, because that doesn't make sense to me. That confuses us. It makes us question, what is it that you're ordering? If you're just asking for a type and screen, on that second blank, just put 00, and it'll let you do that. You're also going to be prompted for the patient's transfusion and pregnancy history. This is very crucial for blood bank. Be accurate. Please answer it completely. If you're sitting in front of the patient, ask the patient, have you been pregnant in the last 3 months? Have you been transfused in the last 3 months? That's very, very important. If you're going to be, at the end of that, you're going to go ahead and verify your order. We'll see it on our side. Now, if you're going to be collecting the specimen, again, you know, when we're collecting specimens, we want to be real careful about patient identification, checking armbands, making sure we're drawing the right person. This is so important in blood bank. What we're going to collect is a pink top. We're going to follow all the guidelines like you would for collecting any other specimen. We want to be sure to label the specimen with the patient's name, their date of birth, the medical record number, which is the short one. It usually starts with a 00. The date and time of collection, and your initials. It's best to go ahead and use the chart label if that's available to you. If you have it, especially, a lot of times we'll draw these preoperatively when the patient gets to pre-op. If you have that chart label, please use it. Specimens that are not labeled properly will be rejected. No exceptions, absolutely no exceptions. You're not going to come label the specimen, relabel the specimen, say, oh, I accidentally drew it on A when it was supposed to be on the next bed. We're not going to accept those. As far as your specimen, how long they're good for, your specimens are going to be good for 14 days as long as the patient has not been transfused or pregnant in the last 3 months. So type and screens are going to be good for 14 days. If the patient has been pregnant or transfused, we're only going to keep the specimen and be able to use it for cross-matching purposes for 3 days. And the 14 days is a little different than most people are used to. So that's why I'm kind of stressing that. I get a lot of questions about that. Okay, so once you put all that in, we get the blood. We'll go ahead and do the type and screen. Got the cross match ready. Okay, so you're ready to come to the lab and pick up a unit. What you're going to bring is one of these little sheets, and these are available on the unit. Should be able to find that. So what you would do is you would fill in however many units you're going to pick up, which will be 1 unit of, and you'll put RBC or whatever. If it happens to be fresh frozen plasma or platelets or whatever, you'll put that here. You can actually put the patient label here. That just helps us track who you're giving the unit to, making sure we got everything in line. You'll do date and time that you're picking it up, and then you'll sign at the bottom. So when you bring this to the laboratory, I'm going to ask you to visually inspect the unit. I'm going to ask you to match up from the patient label and the administration tag, the patient's name, medical record number, date of birth. We're going to make sure that the unit types are compatible with the patient. And I'm going to ask you to sign off on that. If everything matches, that's when you sign off. Don't say, oh, you know, medical records number's wrong, but I'm still going to sign it off. No, we want to make sure that everything is correct. If any discrepancies, you should go ahead and bring that to the attention of the tech that's helping you. After hours, this is where we get a little confusion, or people feel a little bit uncomfortable because a lot of people haven't had to do this before. You're going to go ahead and bring your unit request to the lab. 2 nurses should do this together if the laboratory is closed or it's after hours. If 2 nurses are not available, you can use a nurse and another healthcare provider. So that may be your CNA, that may be your unit clerk, and that's fine. You're going to locate the unit for the patient. You're going to check the administration tag. You're going to verify your name, date of birth, medical record number. You're also going to verify that the unit number on the tag matches the unit number on the bag of blood. Verify your expiration. Your cross-match results should always be compatible, COMP is what it's going to say, in the cross-match expiration. Both nurses are going to sign the release, and one's going to sign that they released it, one's going to sign that they received it, along with the date and time. That's going to be on the administration tag. They're also going to, this book is always kept right next to the blood bank refrigerator. This is where we record all the results for our cross matches in here. So you'll come to the book. You'll see we have patient name, medical record number, their blood type, the unit number for the cross match type, the compatibility status, and then what the unit type is, whether it's FFP or red cells. So what you'll do is we'll put a date and a time. We'll put who issued it. So if it's yourself and another nurse, one will issue it. You're going to check off that you visually inspected it, making sure that everything matches. And then somebody will sign that whoever received it, whoever it was issued to. If for some reason that unit comes back, you get down there, the patient spiked a temp all of a sudden and you need to return that unit, you'll fill in those same things here with date, time, who returned it, who received it, etc. Don't write anything in this column. This is for the laboratory to use if we send the unit back to the blood center. So you don't want to write anything in the last column. If for some reason the laboratory is not there, you can just leave this right by the blood bank after it's filled in, and we'll see it and we'll take care of it. So I hope that's not too terribly confusing. If you have questions, call us. We'll be happy to let you come down to the lab, look at the blood bank. You may feel a little bit more comfortable if you do that after you've actually seen everything. And we can do a mock one too if you guys would feel more comfortable with that. This is the biggie, the emergency release. So all of a sudden you have no type and screen on your patient, you have no cross-match, you have no units available. We're not here. And all of a sudden you need to give some blood because the patient's bleeding out for whatever reason. The first thing you need to do is find out who's on call for the lab and call us immediately. We can help you over the phone, we can walk you through it. It's best if you come on down to the lab and kind of go through everything and see it. That way when you have to actually do it, it's not your first exposure. We always keep 2 units of O-negative blood in the laboratory refrigerator. What you want to do when you do have an emergency release is take 2 of the segments off of the unit and take a sticker off of the back of the unit and label those segments. Okay, cut. I need